Good morning, afternoon, or evening, everyone, depending on where you're joining us. My name is Dr. Trent, and I am the Clinical Application Specialist at Hexoskin. I would like to welcome you to our first webinar entitled Stress Monitoring with Hexoskin. For the Q&A, please type your question in the box, and we will try to answer them at the end of the presentation. Otherwise, we'll make sure that you will be answered by email after the webinar. Today, for the first part of this webinar, we will take you for a quick tour of our company, and we will go over the different field of application of Hexoskin. And we will present a few studies using Hexoskin as to monitor stress. For the second half, we're glad to have as our special guest, Dr. Nicholas Slaman from Nemours DuPont Hospital for Children. He will share with us his work on monitoring stress in medical staff using the biometric Hexoskin. Good morning, Dr. Slaman, and thank you for being with us today.
Good morning, too.
Finally, we will conclude with our takeaway message and concluding remarks, and our webinar will end with the Q&A portion. To start, Hexoskin was founded and is based in Montreal, Canada since 2006. Hexoskin sets itself the mandate to become the solution to monitor, record, and organize personal health information in order to make it more accessible to everyone. Hexoskin is not only a smart garment. All the body-worn sensors combined to the cloud-based database and the data analysis server constitute the core of the Hexoskin Connected Health platform. So first, here's a list of the key features of the Hexoskin garment. Mostly, Hexoskin is designed and made in Canada. The garment is lightweight, breathable, so comfortable that you can wear it underneath your clothes. Therefore, you can go about your regular daily life activities. Furthermore, the garment is machine washable and is covered in an antibacterial coating that reduces bacterial growth in between washes. Hexoskin is designed to be comfortable, easy to set up and maintain, making it a very practical and effective biometric garment. So now let's discuss the product specification. So on the garment, you have 3 cardiac sensors that allow a 1-lead ECG at a frequency of 256 Hertz. It detects heart rate in a range of 30 to 200 beats per minute. With the cardiac data, it is possible to detect QRS events, calculate RR intervals, and even do HRV analysis. After that, we have 2 breathing sensors that detect the breathing rate in the range of 3 to 80 breaths per minute. And with the data collected, it is possible to calculate the tidal volume, the minute ventilation, and to detect every inspiration and expiration events. Finally, we have the 3-axis accelerometer within the recording device, and it will give you the activity level, the step count, the cadence, and the energy expenditure. In fact, Hexoskin allows you to record more than 20 data channels and more than 30 different metrics. The advantages of Hexoskin is that it's easy to set up, it is comfortable to wear, it is a non-invasive monitoring tool, it adds an activity context to the physiological data recorded, it gives information about the activity, the lung, and the heart function simultaneously. Hexoskin accelerometer generates more accurate data than the typical activity tracker due to its location closer to the body center of mass. Also, Hexoskin allows long-term monitoring, and all the data collection is done remotely. Therefore, the patient don't have to come systematically to the clinic for their follow-up visits. And finally, Hexoskin offers high-quality data. In fact, it records over 42,000 data points per minute. In fact, Hexoskin system is a connected health platform. With our system, you collect rich data, and with the API accessible from our website, it will allow you to push further your analysis and even develop new algorithms for the purpose of your field of study. So Hexoskin system consists in the first part of the shirt and the recording device. Then you have HX services, which is the software where you will synchronize your data to our server to be processed. And finally, you have the mobile app to visualize your data in real time during the recording, and the dashboard to visualize and import your raw and processed data. More precisely, during a recording, all the data is recorded and stored in the device. The device can hold up to 600 hours of standalone recording. The data is synchronized through the software HX services to the Hexoskin secured servers. And from there, the raw and the processed data can be visualized on the mobile app and the dashboard. In the context of clinical research, we advise the researcher to import directly their data from the dashboard to perform their analysis. So to record a session, you simply need to put on the shirt. And to ensure a good quality signal, we suggest that you use the elastic strap and to apply some conductive gel on the cardiac electrodes. And to start the recording, you simply need to connect your device to your shirt and place it in the right-hand side pocket. Here's a screenshot of what can be visualized after the synchronization of the data onto the server. Here we can see the raw data. At the top in red, we can see the ECG recording. In purple and blue, we can see the signal for the thoracic and abdominal breathing sensors. And at the bottom, we can see the 3-axis accelerometer signal. Hexoskin has multiple fields of application. For example, Hexoskin can be used to monitor remotely cardiac patients in general or during cardiac rehabilitation program. Because it monitors cardiac function over a long period of time, Hexoskin becomes a very powerful and very unique tool for cardiac monitoring. Then Hexoskin can be used as a monitoring tool for patients suffering from chronic respiratory disease, such as asthma, COPD, or even cystic fibrosis. Because Hexoskin monitors continuously the breathing parameters, chronic lung disease patients can be monitored more closely and can be treated before the deterioration of their respiratory symptoms and therefore preventing exacerbation and unnecessary hospitalizations. And as stated before, Hexoskin accelerometer tracks activity. And recently, different teams have developed different applications based on our accelerometer. Interestingly, a team from the TELUC University in Montreal have developed an application for fall detection. It is in fact able to detect with great precision and accuracy if the patient is falling forward, backwards, on the left or on the right side. Then our team have also developed and validated a tree decision algorithm for sleep state classification. And since Hexoskin has been used for sleep monitoring in different studies and can eventually be used as a screening test for sleep disorders. Hexoskin has also been used to study cognitive state. For example, there's a team at the Wright University in Ohio who has worked on an application to detect the onset of dementia based on the cadence to detect the change in the patient's behavior. And finally, but not least, Hexoskin has been used for monitoring stress level. So why is it so important to monitor stress level, and why do we want to monitor it? So as we all know, nowadays, everyone experiences stress at work or in their daily life. And if high level of stress persists and is not monitored or managed properly, in the long run, it will affect the performance and productivity at work, and the physical and the mental health can also take a toll. So this is why at Hexoskin, we believe that stress monitoring is very important. And Hexoskin has developed and is providing different type of stress indicator. Because stress level can be measured with a different physiological parameter, such as heart rate, breathing rate, minute ventilation, sleep quality and efficiency, as well as the heart rate variability. In fact, Hexoskin provides up to 11 different measures of HRVs. And 2 of these are automatically calculated and displayed on the Hexoskin dashboard for specifically the rest and the sleep activity. So based on this, different research teams from the Hexoskin community have used our very unique technology to monitor stress in their study taking place in very different contexts. The first study is a recent study from a French group that used Hexoskin to measure the stress level of ICU physicians. Indeed, the objective of this study was to compare 6 different new types of ventilator based on their technical performance and ergonomics. The stress level of the ICU physicians were evaluated on efficiency, engagement, ease of use, and tolerance to error while they were trying out the new ventilators in the context of their work. In fact, most of the new ventilators seem to cause an increase in the physician's stress level during the experiment. We can see here in the graph on the left that for all the new ventilator, an increase of the respiratory rate measured by Hexoskin was observed when compared to the reference device. And we can see the same pattern for the heart rate, middle graph, and also the tidal volume, graph on the right, when the new ventilators again were compared to the reference device. The increase of the physician's heart rate, respiratory rate, and tidal volume activations were an indication of an increase of their stress level while they were testing out each of the new ventilators. Hexoskin was therefore a very important tool for the evaluation for the new model of ventilator, as it can determine if the physician were comfortable or getting stressed out by the new equipment, and if they were more likely to make a medical error while using these new ventilators. Another research group from Germany this time used Hexoskin to monitor the cardiac function during their pilot study. In fact, they hypothesized that a breathing exercise could lower the heart rate variability. The breathing exercise consists in lowering the breathing rate to 6 breaths per minute in order to restore the balance between the sympathetic and the parasympathetic nervous system. The participants were asked to complete 4 sessions of climbing course of a duration of 35 minutes each and with a 5-minute break in between. And the breathing exercise was done during the breaks. So on the graph on the left, we can see that when compared to the control group, the intervention group in green, meaning the group that was performing the breathing exercise, showed a lower overall heart rate during all the breaks in between the 4 sessions. In the same way, we can see in the middle graph and in the one on the right, an improvement of 2 different HRV measures for the participant in the intervention group, meaning that the breathing exercise seemed to have a positive impact on their cardiac function. Then the author compared the cardiac values collected at the beginning and at the end of the 4 sessions. On the left panel, you have the control group. On the right panel, you have the intervention group. We can see that throughout the sessions, it seemed that on the right panel, that the breathing technique helped decreasing the heart rate and increasing 4 different HRV measures for the participant. For now, the author were only able to show a non-significant trend of the positive impact of their breathing exercise. However, these results still suggest that their breathing exercise is a cost-effective tool that could potentially improve the cardiac autonomic function. And as their next step, the author were planning to do a follow-up study, but in a work context this time. Another study from a team from the Houston Methodist Hospital used Hexoskin to measure the stress level during minimally invasive surgery training. Knowing that high HRV value means that the body has a stronger tolerance to stress and can recover more easily from prior accumulated stress, the author showed that the untrained surgeon exhibited a lower HRV than the trained surgeon. This suggests that the untrained surgeon experienced more stress during the surgical procedure, which was expected. This study showed that Hexoskin has a great potential to become a stress monitoring tool for the medical staff member, something that will also be shown by Dr. Slaman's work. So now I will give the floor to our guest speaker, Dr. Slaman.
Thank you, Dr. Trin. So folks, thank you for having me today. I wanted to put a shout out to Pierre as well as Mark and Dr. Trin for inviting me. It's very exciting to be able to present our work. So just to give a little bit of background, about 4 years ago in Philadelphia, everyone was pretty excited about the hiring of a new football coach, an American football coach who had been a head coach at the University of Oregon and then became the Eagles head coach. His name was Chip Kelly. And he brought in a lot of new ideas in terms of nutrition and sleep and muscle recovery and tracking of athletes' ability for jumping higher, running faster, explosiveness. And unfortunately for the citizens of Philadelphia, Chip Kelly's tenure turned out to be very poor. But one of my colleagues at the Children's Hospital of Philadelphia, Vinay Nadkarni, took time to interview Chip Kelly as well as interview Mike Krzyzewski, the famous basketball coach from Duke, about how he monitored his athletes. And at a Society for Critical Care Medicine meeting in Phoenix, where the Super Bowl was being hosted that year, he gave this whole kind of sports themed talk about monitoring and all the monitoring that's happening with athletes, and could we apply that to critical care patients to make care of the patients better. And after the meeting, I was intrigued by Vinay's idea, but I had a different idea. I said to him that we do lots of monitoring for the patients. Currently, all of our patients in the intensive care unit are on continuous heart rate monitor, respiratory monitor, pulse oximeter for saturation. Some have invasive blood pressure via arterial catheter, others have cuff. We measure end-tidal carbon dioxide coming from a ventilator. We have ventilator parameters that we measure minute to minute in terms of pulmonary compliance. So we have lots of data, but nobody really does anything with it. And my question, my curious question to Vinay was, what happens to us, the critical care practitioners, as we deliver this critical care? What happens to us as we put in a central line? What happens to us when we have a patient who's having a cardiac arrest and we have to resuscitate them? You know, the doctors are always worried about healing the patients, but sometimes we have to heal ourselves if we want to take good care of our patients. So that was the initial idea behind this study. And I partnered with the folks at Hexoskin, purchased some of the shirts and devices, and then started to really learn more and more about them as we went forward. So the study I'm going to talk about is entitled A Prospective Study of the Biometrics of Critical Care Practitioners During Live Patient Care Scenarios. And you can see my research partners there. The important thing about this study, I think, is that in the past, if you wanted to measure stress of the physician, you had to have them in a laboratory setting where they were hooked up to wired equipment or wearing a bulky Holter monitor under their clothes, or maybe they had to wear specialized clothes to be able to accommodate all this extra equipment. And they'd have to wear it for long periods of time because you could never predict when you would have to intervene. When would a patient have a cardiac arrest, or when would they need a breathing tube inserted? So the Hexoskin was really revolutionary because, as Dr. Trin pointed out, it's very non-invasive. You can wear it under your clothes. You can tuck the brain into the pocket in the shirt, and you're pretty much ready with your own physiology lab to wear for somewhere between 14 and 15 hours of battery life continuously. So again, the kind of theme here was to focus on critical care monitoring of the practitioners rather than the patients. And, you know, get them out of the physiology lab, get them into real time taking care of patients that are live. And then the question that I think comes up, the obvious question is, if you can succeed and make this monitoring happen and get interpretable data from it, does it mean anything? Can you do anything with it to then improve the care of the patients? So the subjects would wear the Hexoskin device and they would track their biometrics during scheduled work activities in a 24-bed tertiary care pediatric intensive care unit. And by tertiary care hospital, we're a referral hospital for all the hospitals around us. We have all the pediatric specialists and surgeons that one would need to take care of just about any emergency. So we collected data on heart rate, respiratory rate, and heart rate variability as our markers of stress. Obviously, as Dr. Trin pointed out, the Bluetooth connectivity from the shirt to a cell phone allowed us to display our vitals in real time, and the Hexoskin brain was recording that for later data analysis. So just as an introduction, this is the Alfred I. DuPont Hospital for Children. It's in Wilmington, Delaware. Nemours Foundation was established by Alfred I. DuPont, who was initially a gunpowder baron in the Civil War and then became a newspaper magnate in Jacksonville, Florida. So our home base is in Jacksonville. We have a hospital here in Wilmington. We have a hospital, a sister hospital in Orlando, and we have clinics throughout Delaware, New Jersey, Pennsylvania, Maryland, Florida, and Georgia. So at our particular hospital, we have a 24-bed intensive care unit. We do somewhere in the neighborhood of 1,500 admissions to the ICU per year. We have a separate cardiac intensive care unit, and we have 300 cardiac pump cases per year with 2 surgeons. And then as a referral hospital, we take about 4,000 transports from external hospitals that say, these children are too sick for us, we need to send them to your specialty hospital. So here's some kind of visuals of what my daily life looks like. And in the top left corner, that actually happens to be my son, and this was staged. He was not sick at the time. But you get the idea that we have a lot of nurses, we have a lot of respiratory therapists, we have a team approach, and the patients can be very sick. And in the right lower corner, you can see a baby with some ECMO some extracorporeal membrane oxygenator cannulas, heart-lung bypass machine essentially coming out of their neck. So our patients can be very small and they can be very sick. So the question becomes, and again, this is intended for the audience that's a mixed group of people, I would assume. Not many people may know what a pediatric intensive care physician's life is like or what do we do. So what's so stressful about all this for you? Well, again, our patients are smaller than adults. They have a different physiologic interactions between heart and lung often. They have smaller reserve and they have less room for error. So the key events that we selected to evaluate while wearing the Hexoskin shirt were leading patient rounds, and that basically means going from room to room with a group of residents and fellows, talking about the patient and making a plan for the day. And that doesn't sound very stressful, but mix in maybe a very stressed out parent, maybe a very unstable parent, and rounds, maybe an unstable patient, and rounds could be very stressful. We recorded a family meeting to deliver a difficult prognosis. So giving bad news can make the provider very stressed and anxious. We measured while wearing the shirt during a code blue resuscitation, so a cardiopulmonary arrest where the patient was on the verge of death, trying to resuscitate them back to life. And then two of our other key interventions in the pediatric ICU is endotracheal intubation. So a patient who has respiratory failure and needs a mechanical ventilator to breathe for them, well, we need a highway to be able to let the machine do its work, and that's insertion of a breathing tube into the windpipe, which can be a very harrowing experience. And then a central line insertion. So if you've ever been to the hospital and had an IV inserted, those IVs are temporary, they don't last very long, and they, in children, tend to be more difficult to place because the children's veins are very tiny, and we give lots of medications that could be caustic. So sometimes we need a bigger catheter, and we usually will insert what's called a central venous line into the jugular vein, the subclavian vein under the collarbone, or the femoral vein in the leg. And that can also be a fairly stressful experience. So during patient rounds, we discuss the patients. New patients are coming in, others are being moved out. As I referred to earlier, the parents are often very, very upset and anxious because their children are sick. And we're responsible at the same time as we're rounding for teaching these junior doctors. They've completed medical school, but they're training to become pediatricians, or maybe doing an extra 3 years to become a critical care attending like myself. Then you have to record all this that you've done. So you have to write notes, you have to perform procedures. So you kind of get the idea of what's stressful. Endotracheal intubation, on the other hand, takes another step up. So I've kind of labeled the main steps in the procedure, but supporting a patient with oxygen and breathing for them through a mask while you sedate them with anesthetic and get them ready for the procedure is seen in step 1. Step 2, we use essentially a specialized flashlight called a laryngoscope to insert into the child's mouth. The child has to be positioned just right to make sure your view will be perfect. Their tongue often comes into effect, and lots of secretions and saliva can make things harder. And trying to visualize the airway properly is what that step is all about. And then step 3 and step 4 show you the actual insertion of the breathing tube between the vocal cords of the patient. So again, children are small, they have a very small functional residual capacity, and they can desaturate very quickly and become blue. That often leads to cardiac arrest. So putting a breathing tube in is a fairly harrowing experience, and it needs to be done quickly. Central venous line insertion. In the upper left-hand corner, you can see our landmarks for trying to identify the jugular vein. We used to do this blindly when I first started as a fellow by palpating the muscles, looking for certain physiologic landmarks, anatomic landmarks. We don't do that anymore. So in the upper right-hand corner, you can see a sterilely placed ultrasound probe. So now we cheat a little bit and we get a picture, but it still takes kind of hand-eye coordination, almost like playing a video game. One hand is using the needle, one hand is using the ultrasound. Your eyes are looking between the patient and the screen to get that central venous line inserted properly. And it takes multiple steps. It's more than just putting the needle in. There's a needle, there's a wire, there's a dilator, and then finally the catheter and suture to hold the catheter in place. So these things, as you could imagine, in a patient who's very small, sick, and unstable, could be nerve-wracking. So our initial data analysis was on a critical care physician. Yours truly, I was 44 at the time and 10 years post experience in fellowship. I wore the garment for 28.05 hours, not continuously obviously, but I wore it over that period of time. And the ICU events that I abstracted for myself and looked at in time were patient rounds. So I wore the garment for about 3.5 hours. Tracheal intubation, that procedure took about 16 minutes. A family meeting to deliver bad news, that was about 8 minutes, followed immediately by a code cardiac arrest on the same patient. So I was in the room delivering news to the family that things don't look good, he's very sick, he's very unstable. And right at the end of that meeting, he had a cardiac arrest. So I conveniently used the Hexoskin to measure that experience and try to resuscitate the patient. So in terms of stress level, from highest to lowest for me, intubation was the most stressful, code blue was the second, rounds was the third, and family meeting was actually a fairly calm experience for me. It was not particularly stressful. Just to point out some comparisons. So intubation, my max heart rate and respiratory rate recorded by the Hexoskin was 147 beats and 52 breaths. So I was pretty stressed. I compared that by wearing the Hexoskin while I ran on the treadmill for 12 minutes, and my treadmill test was 153 beats and 48 breaths per minute. So you can see that, you know, the intubation was fairly stressful for me, and it was not straightforward. It was a small former premature infant who was still very tiny and had a difficult airway. So thankfully I was able to get the breathing tube in, but it was stressful. The family meeting, on the other hand, 93 beats per minute, 36 breaths. So we did an analysis of standard deviation of the R to R interval, and we had statistical significance for both heart rate and respiratory rate with a P less than 0.001. We then did further testing, so we did SD testing of equal variances and a fast Fourier transformation. This was before the Hexoskin folks had introduced us to the VivoSense team, so we did a lot of this on our own. But when comparing tracheal intubation and the code blue, tracheal intubation again was confirmed as the most stressful of the experiences for me. So just a little bit of background, Dr. Trin kind of referred to this a little bit, but heart rate variability, more than just looking at heart rate and respiratory rate, we think gives more information about relative stress. And there's constantly balance between the sympathetic and parasympathetic tone, and that fluctuates based on your fight or flight reflexes. What are you doing at the time? In simplistic terms, the faster the heart rate, the less heart rate variability exists and suggests more stress. So a lot of people, I think of the heart as a metronome or a clock that's ticking, and it always ticks 1/60th as it goes around for 60 seconds. That's actually not true. You know, athletes with a low resting heart rate in the high 40s, low 50s, they may have lots of heart rate variability. It may be 48 1 minute, 52 the next. They stand up, they walk to the kitchen, it changes to 56, then it goes back down. But as your heart rate gets faster and faster, as you're more and more stressed out, there's less variability between those R to R intervals because the heart is beating so much faster. So you can imagine a heart rate of 53, lots of variability, but a heart rate of 153, less R to R interval variability. So heart rate variability is complex to kind of analyze, and there's several different techniques that we looked at before we wrote the paper to say what would be the best for us. So there's statistical analysis or time domain analysis. There's frequency domain analysis, which is also called a power spectral analysis. And the VivoSense software that I refer to and I'll get to in a couple slides looks at that. And then we decided to go with what we thought was the best option, which is nonlinear or geometric analysis, and they're referred to as POINCARÉ plots. So time and frequency analysis in our reading and our research can be limited by assumptions made about the data, can be limited by ectopic beats. There seem to be so many drawbacks to it that we decided to focus in on the POINCARÉ plots. So just a quick review of POINCARÉ plots. So again, a geometric, nonlinear method to assess dynamics of heart rate variability. The plot provides a summary of information of the dynamic changes of autonomic function as you vacillate between sympathetic and parasympathetic surge, and what does that do to the RR interval, and it causes it to vary. So the shape of the plot is going to communicate to you the degree of the stress of the participant. So just as an introduction to what a POINCARÉ plot looks like, so the markings of the plot are gathered around a line of identity, and the slope of that line is 1, and you can see that in the green. The center point represents the average RR interval for that tachogram. And then a quantitative analysis involves fitting an ellipse around the center point and then calculating an SD2, a longitudinal measurement, and an SD1, a transverse measurement. And I'll get into what that means in the next slide. So the transverse width of the plot, the SD1, is a representation of parasympathetic activity. That length or longitudinal segment, the SD2, is a representative of sympathetic activity. So then if you put them together and you look at the shape, an elongated torpedo-shaped plot is more sympathetic. A rounded fan-shaped or oval plot is more indicative of parasympathetic tone, which you can see in plot A, the sympathetic being represented in plot B. So as I alluded to earlier, a partnership between Hexoskin and a sister company called VivoSense allows very easy extraction from the Hexoskin dashboard into the VivoSense software where you can really crunch these numbers. So you can see on the left slide is my intubation SD1, SD2 of that difficult premature infant. And you can see it's very, very sharp and it's very, very narrow. And it compares nicely to my treadmill test. And as the numbers, the SD1, SD2 ratio gets closer to 0, that indicates more stress. As they get closer to 1, that indicates less stress. So in the second panel, here's my code blue, which is still pretty stressful. I mean, you can imagine the patient is dying in front of you and you have a team that you're trying to get to execute all the steps to try to successfully resuscitate the child. So it was still stressful, but it was not quite as sharp and narrow as that intubation. And you can see the ratio is a little higher. Instead of 0.03, 0.04, it's 0.15. The family meeting was comparable, a little wider scattered, but 0.15. And then finally, the rounds, which for me, I don't find particularly stressful. I enjoy teaching residents and fellows. I enjoy talking to the families, even a stressed out family. I think it's one of my talents to be able to kind of talk them down off the ledge and assure them that things are going to work out. So that was not particularly stressful for me. And you can see the oval fan shape and the ratio is rising. It's 0.21. Now, just for comparison and just for fun, I wore the Hexoskin and recorded myself at sign out. So sign out for us means that you finished your 15-hour shift from 4 p.m. to 7 a.m. and you're pretty much toast at that point and you're done. So I was very unstressed at that point, and it was 0.48 on my ratio and very fan-shaped and scattered. So I drew some conclusions, although they're limited because there was only one subject. But based on the analysis of heart rate, respiratory rate, and heart rate variability, my most stressful activity was endotracheal intubation. By POINCARÉ plot, both the shape and the SD ratio of endotracheal intubation were comparable to my exercising, running on a treadmill. Code blue and family meeting were also stressful, but less so than intubation. Patient rounds was the least stressful, as evidenced by its oval shape. The Hexoskin device appeared to allow for accurate measurement of wearer vital signs in live, real time. And then further study was the conclusion that we needed to do more. So this is what more looks like. So we recruited more subjects. So in addition to myself, we enrolled some fellows. I believe we had 1 third-year fellow, 2 second-year fellows, and a first-year fellow, and had them try to replicate activities that we all do on a daily basis that wouldn't be that hard to collect. So a code blue, thankfully in pediatrics where there's a cardiac arrest, is fairly rare. It doesn't happen every day, but we round every day. Intubations happen at least once every other day, a couple times a week, and central lines usually go with an intubation. So as you can see from the plots, we had a resting measurement as well, so that we had an adequate comparison to what were you doing at home compared to what you looked like here. And for most people, rounds looked pretty unstressful. Intubation, however, was fairly sharp and comet-shaped, and central line were also fairly sharp compared as well. So a lot of resting and rounds activity were more or less stressful activities for us. The interesting thing to point out for any of the fans of the TV show The Walking Dead, so my resting measurement, I'm subject A. I picked the time when I was watching television. it's The Walking Dead. It's a really stressful TV program. You never know when the zombies are going to attack or when someone's going to die. So maybe I should have picked something like a cooking show instead of The Walking Dead, and my POINCARÉ plot would have been a little less stressed. So the part 2, as I alluded to, we enrolled some extra folks. We took our baseline measurements, our intubation, our central line, and our leader of patient rounds. And again, because code blue is fairly rare, we excluded that from the analysis. We couldn't get everyone to have gotten a code blue, so we decided to go ahead with our analysis. So here are some of the baseline characteristics that we collected. So you can see the ages on the left, kilogram body weight, height. So weight and height are important because when you initialize your Hexoskin to make sure your calorimetry is accurate and your stride length is accurate, if you're going to be counting steps with it or you're going to be burning calories and measuring those, you want to have accurate height and weight. And you can see who the subjects were, attendings and fellows, their predicted max heart rate, and then their heart rate reserve. So here's some of the activities that we looked at, and these were just heart rate comparisons. And I've added some red boxes to draw your attention to things. So a resting heart rate of 87, Round's heart rate was similar at 85, but the intubation heart rate jumped up to 116 with a range of 95 to 147. So these are all averages. So a change in heart rate, average change about 33%. Subject D also found intubation fairly stressful. And then subjects C and E found central venous line insertion more stressful for them. So 62% for subject C and a 39% change for subject E. So heart rate variability, again, using the VivoSense software, we were able to calculate those SD1, SD2 ratios. And again, closer to 0, more stressed, higher, less stressed. So subject A, I've already revealed as me, and my SD1, SD2 ratio is very low, suggesting I was pretty stressed out. So this was interesting. We looked at the p-values. So p-value takes into account that, you know, how much chance is there that these two comparisons you're making are just strictly due to chance. So we kind of arbitrarily assign that a 0.05 p-value or less is a valuable measurement, less than 5% chance that this is due to coincidence. So the p-values when comparing resting heart rates, mean heart rates to rounds, max heart rates to rounds, and SD1, SD2 ratios, none of them are significant. None of them are less than 0.05. But both mean heart rate, max heart rate, and SD1, SD2 ratios are all very significant when inserting a breathing tube and inserting a central line when compared to baseline. There's a big change when doing those procedural activities compared to your resting baseline that are not due to chance according to statistical probability. This figure just kind of gives you that same summary that yellow intubation and pink or reddish central venous line insertion, when looking at heart rate comparisons compared to resting and other activities, they're statistically significantly higher. So what does this all mean for us? So we've recently finished this paper and we've submitted it to the Journal of Critical Care Medicine for consideration for publication. And these are some of our conclusions. So the study demonstrated to us that it's possible to quantitate physician biometrics. The things that I couldn't conclude, though, is the true practice implications are unclear. In physician life these days in 2017, almost 2018, burnout is a huge, huge topic of conversation. Physicians are unhappy with their career, they're unhappy with their work, they're unhappy with their hospital. Lots of them are leaving practice. Why are they doing that? How can we make careers longer? And what's the health of general physicians? Do they have shorter lifespans because they spend all their time working and being burned out and unhappy? And could we do anything about it? The other questions that came up, so all of the measurements I took, with the exception of rounds, are fairly acute stressors. So a code blue is a fairly short in time period of activity. Intubation you saw was about 16 minutes. Central line insertion was about 8 minutes. So they're fairly acute stressors that then go away. What's the difference between those and a more chronic stress? I think there's lots of data out there that says if you're stressed out and you're stressed out all the time, all day, every day, that's probably worse than an acute fight or flight reaction if somebody tried to steal your purse. But we don't know for sure if these short bursts of high heart rate are bad for you, good for you, or don't mean anything. The other thing that came up, so call shift variation, I alluded to the fact that sometimes I work from 4 p.m. till the next morning at 7 a.m. How does that compare, the stress of working in the middle of the night when you're supposed to be asleep compared to working during the daylight hours? Does it matter how complex the patient is? Does it matter how many other patients are in the intensive care unit at the same time? So we like to say in PICU that it only takes one patient to kind of derail your whole day, and you really have to scramble to get back in control. But what if you have 5 patients out of 24 that are all sick at the same time? We did want to conclude, though, that critical care activities that require not only thought and focus and planning like rounds, but also the physical execution of a skill like inserting a breathing tube or inserting a central line were definitely higher in terms of levels of sympathetic activation and were more stressful by that measurement. And then some of our conclusions were that we want more real-time study of practitioners in various levels of experience like we have in our fellows. But again, 5 fellows is probably not enough. Use of stress mitigation techniques, correlation with procedural success or failure. So if you're stressed out, do you still get the breathing tube anyway? That's probably okay. So I have a couple slides of references if anyone's interested, and then just a few more thoughts that I did not put on the slide. So we are planning a multi-center study to get as many residents, fellows, critical care attendings all doing the same things, so we could have 100 intubations to compare, 100 central lines instead of 5. We compared against ourselves in the study for critical care medicine. We like to compare to large groups. We'd like to investigate using Hexoskin across different specialties. So this is what happens to pediatric intensive care physicians, but what about adult practitioners? Maybe they're not stressed at all, or maybe emergency room physicians or anesthesiologists. What do they look like when doing the same procedures? We share a lot of the same procedures, intubation, central venous line. The next question obviously was impact of training. So once you know what the numbers are, can you do anything about it? Can there be improvement? Can you introduce meditation? Can you introduce tactical breathing to try to slow down your heart rate? And does that mean anything for your success? Do you get the intubations more often if you slow your heart rate down, or is that fight or flight response needed to be successful? And then, you know, we have a couple other studies going on right now with Hexoskin. So my fellow, Dr. Parker, who participated in this study, is doing a simulated study. So instead of live patient care, it's with mannequins and simulation, but he's comparing pediatric residents who don't have a lot of experience to resuscitating emergencies versus our visiting emergency medicine doctors that come to our unit for a month at a time. Who's better at running a code? Who's less stressed? So in addition to taking down the biometric data, we're doing some scoring of their simulated study to see who did the scenario better, who did it faster, who got more points correct when you compare those two groups. And then a really interesting study with in partnership with the Children's Hospital of Philadelphia, and one of our participants today, Warren Frankenberger, is looking at emergency room nurses wearing the Hexoskin. And do they have a level of stress leading up to the procedure that they're going to do? Then we're measuring them during the procedure. Maybe they're inserting a new IV or a Foley catheter. And then do they stay in a state of sympathetic arousal for a period of time after that? Or do they return back to baseline quickly? So I think the Hexoskin and the subsequent partnership with VivoSense really gives you a dynamic physiology laboratory that is completely portable, and you can apply to so many different situations that it really has become valuable for my research.
So thank you, Dr. Slaman. It was, your work is really impressive. We hope to have more of these type of studies that would use Hexoskin the same way that you're using it. So we're just gonna finish with the concluding remarks, and then we'll move on to the Q&A portion, if that's okay with you.
Sounds great.
Okay, so the concluding remarks, we showed that Hexoskin is not only a practical, but also a reliable biometric garment that allows real-life monitoring, but Hexoskin is also a complete connected health platform that allowed researchers such as Dr. Slaman that showed you to access rich raw data to push further your analysis. Also, we showed that Hexoskin has multiple field of application and is a very unique tool for stress monitoring, as it can measure the heart rate, the breathing rate, the minute ventilation, the sleep quality efficiency, and as well as the HRV. And at Hexoskin, we encourage and promote good science and the development of new research projects by providing support with research protocol design, with best practice to use Hexoskin, and also by providing assistance throughout the study for you to reach your research objective and to maximize your Hexoskin experience. So therefore, if you want to start any research project with Hexoskin, please do not hesitate to contact us. We'll be happy to help you out.